I feel Langimalie responded with courage and confidence, and that's what you need in a critical situation like we have.
I think Langimalie has done very well to get to where we are today. It was not easy, of course. We learned a few new things which will help us in the future.
This team, they know their purpose and they are here to deliver to the best of their capacity, and not only that, but grow the workers. Langimalie is doing both.
I think the Tongan response to this campaign has been on the whole outstanding. Tongans generally stand up well and embrace common objectives in their communities, and this campaign's allowed them to do that.
The standout experiences for me at a personal level has been the opportunity to see firsthand what it's like to work at the front line.
Being able to work on the ground with the staff, I think it's allowed the team to get additional motivation when they see leadership on the ground with them working together on a public health initiative.
It encourages me and motivates me to come in every weekend to see how the workers all working together as a team. There's no complaint, there's just positivity and action.
It's important at a governance level to understand how the investments that government has placed on the Langimalie Clinic to deliver this work is actually carried out professionally in a manner that upholds the integrity of the investments by government, that this is being put to good use.
I would like to thank Dr. Clan Dowdy and the workers. As a board member, I am so grateful and happy and proud to be part of that team.
I just want to acknowledge that there's been a lot of work involved by the organisation and its teams, but also the stakeholders that have supported us to allow us to stand up to these projects and achieve the vaccination rates and outcomes as an organisation. Tongans generally stand up well and embrace common objectives in their communities, and this campaign's allowed them to do that across different mediums, whether that be community-based organisation, churches, sports clubs. Tongans can stand up to events, and Tongans can support and embrace other Tongans to get the job done when it's needed with the support by their leaders. In terms of an ethnic specific population, I think they've done extremely well. An example of that was Super Saturday. They accounted for 6.1% of the total vaccinations on that day were Tongans. And actually the reason for that was because of the efforts of the Langimalie medical centres on Super Saturday. I think the things that have stood out for me over the campaign from an organisational and leadership perspective, for me personally and professionally, being able to work on the ground with the staff at all these events, I think it's allowed the team to get additional motivation when they see leadership on the ground with them working together on a public health initiative. At a leadership level, it's also given me an opportunity to develop skills that I probably didn't know I had, but in the context of planning and promoting public health events in this context, certainly brought out some skills that I have been able to develop and consolidate. From an organisational point of view, it's allowed me to develop the organisation to have more of a public health focus, because at the moment we largely focus on personal health issues. It's certainly allowed us to broaden our public health net, if you like, and to consolidate staff with skill sets to underpin that. The strategic priorities of the society have changed over the campaign, and we've reflected as an organisation what our future work program may look like. And at this point we've decided that we would unbundle all our COVID work program and put it into a specialised unit, and that unit is in the process of being established as the Langimalie COVID Response Unit. That unit fits under a wider program called a Strategic Tongan Engagement and Enhancement Program. So we have reflected, we've taken stock of what we need to do in the future, based not only on government imperatives, but the model of the organisation underpinned with those imperatives. The Langimalie COVID response unit will focus on a wider work program that will include SIQ or CIQ, which is looking after people in the community with COVID, a mobile outreach service that will focus on testing and vaccinating people, also MMR catch-ups, national schedule, immunisations for 0 to 5s, as well as social services in an outreach context. We'll also be focusing on events, collateral logistics, communications and promotions. We'll also be adding in specific COVID navigation services, which is going to be focused specifically on recalling people who are eligible for vaccinations. Pandemics can spontaneously resolve, but also pandemics can play out much longer than we expect, because in virology, antigenic shift and drift plays a major part in mutations and different strains. So we are still learning about the epidemiology of this virus, and we've certainly seen some of the variants, but we're also seeing new variants. And until we understand that epidemiology of new variants, it's hard to say how this will pan out in the future. But I expect in the medium term, we're certainly going to live in a COVID society with a pandemic context.